On the Chinese mainland, some cities are ramping up mass testing and some others have imposed lockdowns as the whole country battles the latest outbreak of COVID. The northeastern province of Jilin is the worst hit in this round, with 895 infections out of the more than 1,300 new local cases reported on Monday. Shandong province has recorded 92, Guangdong 79. The spread of the Omicron variant has prompted Jilin's provincial capital of Changchun to set up a temporary hospital with more than 1,500 beds. To the south, in the Chinese tech hub of Shenzhen, millions of residents have been ordered to stay home for a week. Now, for the latest, let's go to our reporters Yu Li in Changchun in northeast China's Jilin province, Wang Siwen in Shanghai, Xu Hua in Shenzhen, and An Chan in Hong Kong. Let me start with you, Yu Li. Changchun, it looks like it's been badly hit by the latest outbreak. We understand the city is in lockdown. How are people coping and what are the latest measures?
The city, we were allowed to enter into the city after showing police our negative results from our COVID-19 test taken within 48 hours. But I'm told it's easy to come in and hard to go out. Here in Changchun, restaurants, shopping malls and entertainment venues are all closed. As you can see, the city life is basically normal, but very few people and cars going around. And this is one of the main streets in the city. And neighborhood small markets selling food and basic goods are still open. Our residents can buy things from there as long as their health code is green. The city has finished a third round of testing for all residents and reported 430 cases this morning. Meanwhile, Jilin City has reported about 550 cases on Monday. Jilin City will conduct its 8th round of testing for all residents. And both cities have prepared thousands of beds in hospitals and temporary hospitals. Health authorities have given isolated close contacts traditional Chinese medicine to use if they see fit. Authorities say they hope to find every case as soon as possible. That's all from me for now. Back to you.
Thank you very much, our reporter Yu Li in northeast China's Changchun city. Now let's go to our reporter Wang Siwen in Shanghai. Siwen, how's Shanghai coping with the latest outbreak? We've heard that several universities in the city are in de facto lockdown.
Hi, Pandang. So far, 41 new cases have been reported, and 128 asymptomatic cases, infections have been reported. And for the past 48 hours, the city has seen more than 200 cases and infections. And now Shanghai has 8 medium risk areas. And Shanghai has suggested residents not to leave the city if not necessary. And for those who have to leave or arrive in Shanghai, must show their negative nucleic acid testing within 48 hours. And Shanghai, starting from today, Shanghai has suspended all its long-distance passenger bus service. And for the for some like 9 long-distance bus services, like linking neighboring cities like Zhejiang, Jiangsu, and Anhui province, will be suspended as well. And all the Shanghai has suspended all its primary, middle, and high schools, and students need to shift to online classes until further notice. And all kinds of kindergartens and kindergartens and preschools have been suspended as well. And all kinds of institutions like training centers, especially childcare services, have been suspended, like in-person instructions. And Shanghai is a city with 24 million people, and this increasing demand of testing have put a big burden on the medical workers. And to cope with this, the city has been extended the testing personnel and extended the testing hours to cope with this. And today, the Dr. Zhang Wenhong, who is the head of the Center for Infectious Disease at Fudan University's Huaishan Hospital in Shanghai, has sent a microblog this morning to explain the latest spread of the virus. And he said it's not so much because of a longer winter, but rather because of a cold spring. Back to you, Pandang.
Thank you very much, our reporter Wang Siwen in Shanghai. Now let's go to Xuhua in Shenzhen. Hello Xuhua, how is the city coping? As we understand, it's also neighboring Hong Kong, which is also dealing with a quite bad COVID situation.
Well, Shenzhen's local government on Sunday announced a week-long restrictions. It's not a kind of a lockdown, but restrictions to avoid large amount of movement among the city's 17.5 million residents. For company employees, they are required to work from home and all business operations are suspended. The only exemption from this rule are for employees of businesses involved in utilities and supplying daily essentials, along with groceries, pharmacies, medical institutions, and catering enterprises that provide take-out services. For the transportation part, all buses and subway operations within the city are suspended, except for transportation to ensure the city's functioning and the freight sending supplies to Hong Kong. Trains will run as usual. Some airline routes will be affected, and passengers are advised to double-check their flights before they are heading to the airport. For people who do need to leave Shenzhen, negative nucleic acid results within 24 hours is required upon their departure. In the coming days, all residents in the city have to undergo 3 rounds of PCR testing. You can see behind me there are people lining for their nucleic acid test. And last night, some residents rushed to supermarkets and wet markets to stock up on food and supplies. Authorities have issued a notice reassuring the public that food supplies are sufficient and the food price remains stable. So there is no need to panic buy. We know Shenzhen is a hub for China's technology and logistic industries, and people here are very hardworking. Most of them have either brought their laptops home or have packed essentials in order to continue working from their office or workplaces. But residents are very cooperative and they are getting used to this new normal. Back to you, Pandeng.
Thank you very much, our reporter Xuhua in Shenzhen. Now let's go to Changchun in Hong Kong, and we know that 32,000, more than 32,000 actually, new cases were reported on Sunday. What about the situation for the day? As we understand that the chief executive said the situation has not peaked.
Yes, Hong Kong has confirmed over 32,400 new cases on Sunday. After a few days of a downtrend just prior to that, new daily cases stood at over 27,000 just the day before. 100 new deaths were also reported. Majority were elderly people and more than half were unvaccinated. Health officials have warned that Hong Kong's virus situation remains severe and have urged residents not to let their guard down. Now, the outbreak in cases during this fifth wave has left isolation and healthcare facilities stretched thin, which has resulted in authorities allowing infected people to quarantine at home. According to Chief Executive Carrie Lam, there may be some 300,000 coronavirus patients and close contacts who are currently undergoing isolation or quarantine at home. And she said, with so many people put in isolation, the government has been strengthening its capability to support these people, but she admitted that they're still catching up to do so. Lam did say that the 300,000 tally of people isolating at home may be an overestimation because it's based on the assumption that these people must stay at home for 2 weeks, but the rules have been relaxed and infected people can leave their homes if they've tested negative on the 6th and 7th day. The central government has been sending a lot of resources and manpower to help Hong Kong. More medical professionals are arriving in Hong Kong today. Let's take a closer look.
The central government will send experts in batches to hospitals to help us treat COVID-19 patients. The first batch of experts, altogether 75 people, will arrive in Hong Kong later today. And this week, another group of about 300 will come to Hong Kong to provide support. As time goes on, we will receive more and more medical workers from the Chinese mainland.
Meanwhile, according to local media, as many as 60,000 anti-epidemic kits will be distributed by the government each day. And starting Monday, care packages sent to COVID patients will also include paracetamol to help relieve pain and fever, as well as pulse oximeters to measure heart rates and oxygen levels. The number of COVID hotlines handling medical inquiries will also be increased to 200 by the end of this month, and 6 more government clinics will be designated for coronavirus patients. So that brings that to a total of 23 designated clinics. And half of the quota will be reserved for the elderly, which are a priority now. Back to you.
Thank you very much and take care. Our correspondent An Chen in Hong Kong.